Imagine, 1 in 5 women going through menopause are told they should never use hormone therapy again because of fear of cancer or heart disease. According to a 2024 study published in the BMJ, contemporary combined hormone therapy still carries a measurable risk of stroke and thromboembolism. Meanwhile, natural, or so-called bioidentical hormone treatments are booming. Yet there is no large-scale proof that they are safer, and in fact, a 2019 review found compounded bioidentical hormones may carry similar or even higher risks because of lack of regulation. So what really is safer for you? Natural hormones or HRT? Stay with me, because in this video, we'll explore what the latest research actually shows, how to interpret the risks and benefits, and what this means for your body, your health, and your choices in midlife. By the end of this, you'll know the one question you must ask before starting any hormone therapy. Let's begin by defining our terms. HRT, hormone replacement therapy, typically refers to prescription use of estrogen alone or estrogen plus progesterone, approved by regulatory agencies. It is backed by decades of large clinical trials. Natural hormone therapy, sometimes called bioidentical hormones, claims to use hormones chemically identical to those the body produces, but often they are compounded, less regulated, and lack long-term safety data. The confusion is understandable. Natural sounds safer, but safer is not always proven. Before you pick a pathway, you need to understand what your hormone really is and where the evidence stands. The most robust evidence we have is around regulated HRT. For example, a 2022 review in Circulation affirmed that HRT started in the early post-menopause window can reduce all-cause mortality and some aging-related diseases. But the key is timing, dose, and type. Another study in 2024 the BMJ found that contemporary combined oral HRT may carry lower stroke risk than older formulations, but risk remains dependent on individual factors. The takeaway: HRT can offer significant benefits: relief of hot flashes, bone protection, improved mood, and sleep, but it is not universally safe for everyone. Knowing how to assess your personal risk is more important than simply choosing natural or synthetic. Many women and practitioners prefer natural hormones, estradiol rather than equine conjugated estrogen, micronized progesterone rather than synthetic progestins. But what does the evidence show? A 2019 review of compounded bioidentical hormones concluded that they are not standardized, not FDA approved, and may carry similar risks to conventional HRT due to variability in dose and purity. And although product marketing claims safer, the reality is that there are no large randomized controlled trials proving long-term safety of these natural hormone therapies. If natural doesn't come with rigorous testing, is it really safer? One of the most important findings in hormone therapy research is what's called the timing hypothesis. Starting HRT closer to menopause onset, within roughly 10 years, appears to carry lower risk and higher benefit than starting decades later. The route also matters. For example, transdermal estrogen, like patches, tends to have lower risk of clotting than oral estrogen because it bypasses the liver's first-pass effect. Natural hormones often are compounded in many forms: cream, troche, pellet, and the dose and route may vary dramatically, which adds uncertainty. It's not just whether you take hormones, it's when and how that shapes your safety and benefit profile. Let's look at the two side by side. When it comes to HRT, the benefits are real. It can ease hot flashes, calm night sweats, help you sleep, lift your mood, and even protect your bones. Some research suggests that when used correctly and at the right time, it may even lower your overall risk of dying from age-related illness. But there's another side to it. The risks of HRT depend on you. Your personal health history matters. Things like breast cancer, blood clots, or stroke. The type of hormone, the dose, and even the way it enters your body all make a difference. Now let's talk about natural hormone therapy. It's often marketed as body identical, something your body already knows how to use. That sounds comforting, right? And yes, some small studies do show that these natural versions can relieve symptoms. But here's what we don't often hear: most of these natural hormones aren't as strictly regulated. The doses can vary from one batch to another, and there aren't many large studies to prove their long-term safety. Here's a practical example. The Canadian Cancer Society found that women who use combined HRT may have about 5 extra cases of breast cancer per 1,000 women over 5 years. That's not a huge number, but it's not zero either. So the real question isn't natural or synthetic. It's about proof, context, and you. Because natural doesn't automatically mean safer. Not unless it's been tested, measured, and backed by evidence. Real safety isn't about the label on the bottle, it's about the knowledge behind your choice. So what should you do if you're facing these choices? Understand your baseline health. Do you have a history of clotting, breast cancer, heart disease, stroke? These factors matter immensely. Ask about type, dose, route, and timing. If you choose HRT, when are you starting? Which hormones and route? If you choose natural therapy, is it standardized? Is it monitored? Consider goals and preferences. Are you targeting relief of symptoms, bone protection, mood, or longevity? Each goal may warrant a different strategy. Consult a specialist. A menopause specialist or endocrinologist can help you analyze risks versus benefits for you personally. Your best choice is often the one that is informed, monitored, and tailored, not simply labeled natural. Before you walk out of this video, here are 3 concrete questions to ask your health provider. What evidence supports the hormones I'm considering, including dose, route, and formulation? What are my personalized risks in terms of clotting, cancer, and cardiovascular health if I choose hormone therapy now and later? How will we monitor this therapy, and when will we review stopping or switching? And what you can do right now: get a full health review, including blood pressure, lipids, clotting history, and cancer risk factors. If you are considering hormones of any kind, keep a symptom diary for 2 to 4 weeks, noting hot flashes, sleep, mood, and joint pain. Discuss non-hormonal supportive strategies too, such as movement, diet, sleep, and stress control. These enhance any hormone therapy and reduce reliance on it. Being proactive now means you will have control, not confusion, when making hormone decisions. If what you heard today made you pause, reflect, or even feel seen, that means you're ready for the next step. At the Midlife Balance Institute, we're building a space for women who are done guessing and ready to grow with science, sisterhood, and self-care. So if you want to understand your body better, balance your hormones naturally, and rediscover your strength, join our community. Click like if this video spoke to your heart. Hit subscribe to become part of a movement where midlife isn't decline, it's your rebirth. Every week we share grounded science, real stories, and practical tools for women who are ready to thrive, not just survive. Because balance isn't something you find, it's something you create, and it starts right here with you. Take a deep breath, feel your power return, and remember, you're not fading, you're blooming, and you belong with us at the Midlife Balance Institute.